Hello everyone, welcome to the next series under the Ztorm focus. This is V2 and this is about the Shientist on call. This our audio podcast series, I'm happy to highlight that we're collaborating with the ZtormLabostix production is in collaboration with the Renal Patient Support Group, or the RPSG. In this series, we're going to be highlighting simply just a few of the sort of abstracts relating to the works that have come from the Renal Patient Support Group, and I would encourage the sort of listeners the listeners to basically check out the work, the full works through the Renal Patient Support Group, the RPSG, where the full works can be sort of identified and delved into. Here, and part of this series, we're going to be doing a series of podcasts based on key sort of main topics around kidney care, but just highlighting through abstract in that context. I'm going to start off by talking a little bit about renal health, or renal health in transfusion. So chronic kidney disease can be, or CKD, can be summated as the steady and consistent reduction in renal function over time. Patients will have no identifiable symptoms, and it is largely a silent underdiagnosed disease or long-term condition. In the absence of indicators, chronic kidney disease, or CKD, adds significant burden on aspects of health. It is increasingly being recognized as a global public health problem and a key determinant of poor health outcomes. There is more compelling evidence that disadvantaged communities and backgrounds suffer from marked increases in unrecognized and untreated CKD. The risks are well reported and have led to a re-evaluation of the criteria for blood product use, but a significant proportion of transfusion practitioners are still looking to update areas of healthcare practices, in line with healthcare guidances relating to transfusion care, and so that it can prevent problems in relating to anemia, and treating patients at the right time with those who have low hemoglobin or have anemia, and in keeping with the specifics around chronic kidney disease. The aims of this work have been to highlight the need to consider renal health in transfusion care and research to inform best practice. Thank you for listening.